Good evening, students. Once again, welcome back to our channel, Ach'z. So, in this section, we are going to discuss about the complete topic prediction or the question type prediction for your OET exam WLRS section for 14th of June 2025. So, those who already booked your test, try to concentrate on the topics which we are going to mention in this video. And if you want any sample or the latest materials or based on the topic you need some materials, means you can just follow us in our Facebook page. There only we are publishing the materials, because I got many messages related to that. And for this online classes also I'm getting enquiries. We are not taking online classes for OET now, so the slots are not available, that's why. So don't inquire for this online classes, but for the materials if you want, means it's available in our Facebook page. Daily we are updating the reading materials and all over there, so you can just follow our Facebook page for that. And for the preparation guide and for the review section, the question paper discussion, everything we will update in this channel only. So don't forget to subscribe this channel and click on the notification button for all the recent update. So without any further delay, let's start with our section. First, we will discuss about the listening module. As you know, it's approximately 40 minutes. So about the part A section, you can expect some consultation extract. I like to give some topic to asthma education section, pressure ulcer management, pediatric fever consultation, diabetic diet advice, and pre-operative assessment for this joint replacement. So these all are the topics you need to concentrate or you can expect under this part A section. Now about the part B, you will get some workplace related extract and the topic post-operative patient handover, infection control update, safe disposal of sharp items, IV line monitoring instructions, and staff meeting on this patient fall protocol. Okay, then moving towards the part C section, that will be like a interview or the presentation. So the topic under that, nurse researcher on dementia care, presentation on this telehealth in rural setting, talk on medication safety in polypharmacy, mental health care in multicultural communities, and managing long-term condition in primary care. So that's about the topics which you need to concentrate. And whenever you are taking this note and all, try to use some short forms or try to use some symbols, okay, keywords, so it can save your time. Now coming towards the reading module, it's around the 60 minutes. Usually I will add on some rough idea and all, but you are already preparing for this OET exam from years or months, so I don't want to waste my time now, and I don't want to make this video too long. That's why I'm directly saying the topics. Okay, I hope you can follow that. Now about this reading module, part A. So I will add on some topics along with that which you need to concentrate, and the associated materials, not about the materials which we are publishing in the FB that will directly come to your exam. That is to get an idea, rough idea about the concept and make you familiar with the topic. So if you want the passages or the materials in association with the topic, means you can comment over that. Definitely we will include that in the upcoming days. So the topic, wound dressing comparison, catheter insertion and care, managing pediatric fever, diabetic medication guidelines, nutrition for this renal failure, pain assessment tools, monitoring oxygen saturation, emergency response steps, about the CPR and all, pressure ulcer staging, fall prevention technique. So they can give the health related topic, which all are the major health related topics. I think the skin related or diabetic, hypertension, stroke, asthma, these all things are very common for this part A section. We already published that, the materials in association with that, but nowadays they are giving more attention towards this cardiovascular diseases and skin condition, rare skin diseases and all. So in the future days, we will update that in our Facebook page. So try to check on that. Now coming towards the part B section, the workplace extract. So you need to give attention towards this staff instruction on this PPE use, hospital policy for this patient confidentiality, shift handover checklist, then ethical dilemma in patient consent, and also care plan documentation. Coming towards the part C section, that's a long test including some journals or the policy articles and all. So they can give patient advocacy in clinical practice, managing staff burnout, then evidence-based care for this heart failure, and reducing hospital acquired infections. Okay, so these all are the area you need to focus towards. For this part A, you need to scan the heading and the keywords. And for this part B and C, they can ask more inference type of question, opinion based question and all, or those opinion based question and all, or those attitude based question. Then you need to revise this medical synonyms also, because nowadays they are including more synonyms in the reading module and even in the listening section. So try to focus on that area too. For example, for elevated, they can use high. Okay, like that, simple synonyms, but you need to focus on that. Now coming towards the third module, writing, 45 minutes, you know that you need to write a letter based on the case note. So this time you need to focus towards two different category of letter, referral letter and the transfer letter. I like to suggest some topic under both the category. First, about the referral letter, referral to a respiratory specialist for this COPD management. Second one, referral to a dietitian for the patient with newly diagnosed diabetics. Third one, referral to a physiotherapist for the post-stroke rehabilitation. Fourth one, referral to the mental health services for this depression or the anxiety. And to the fifth one, referral to a pain clinic for this chronic pain, any type of pain they can ask for. And coming towards the transfer later, again I will add some topics. If you want the model or sample letter in the sense, try to comment that in the comment box. I will publish that in the Facebook page or in the community tab I can publish. So try to mention that if you want. So the first letter is transfer to a rehabilitation facility for the post hip replacement surgery. Second one, transfer to a residential aged care home for this dementia support. Third one, transfer to a palliative care unit for this end of life management. Fourth one, transfer from hospital to this community nursing after this sepsis recovery. Fifth one, transfer of a patient with unstable angina to a cardiac unit. So these all are the topics you need to concentrate under referral letter and transfer letter. So try to use proper structure. You need to give a clear-cut introduction. You need to add on the background information about the current status of the patient. Then what about the action you want to take, or about the request means you need to add on that. So try to maintain proper structure. Include only the relevant data, because many of them are adding irrelevant data and making it too long. So try to make it more concise, up to the point. So add the relevant data only and use the formal expression. I'm always saying that to try to avoid the informal presentation, try to add on some formal expression. So we already released some common phrases you can use under this letter and the speaking, and also try to check on the playlist and you will get that, or you will get that from our Facebook page. Now coming towards the speaking module, approximately 20 minutes you need to play two different role play cards. So the predicted topic or the predicted role play cards. The first one is reassuring a mother about the childhood vaccination, about the child vaccination and all. Second topic, educating a patient on the insulin. If it is newly started with the insulin injection and all, means you need to add on about the side effect. There will be panic. So you need to reassure them. Next one, discussing the pressure sore prevention with a caregiver. Next, about the giving discharge instruction about the post-appendectomy or any surgical management. And to the last one, encouraging the lifestyle changes for the hypertension patient or diabetic patient about the diet or the lifestyle management. What all are the things they want to concentrate on. Okay, so these all are the topics you need to concentrate under the speaking section. So whenever you are presenting something, you need to take care about the clarity, your tone modification, and try to add on some empathy. Okay, so it's better to study some common phrases, some empathetical phrases and all you can study. which you can apply under different scenarios. So that's available in our channel itself. You can just go through the tips and tricks for the speaking section, that particular playlist, and you will get that. Okay, the common phrases you can use under different scenarios. So try to do 3 to 4 role play cards in a day. Okay, so try to understand your weak areas. Actually, the last minute, especially from June 10 onwards, you need to focus on your weak areas, how you need to modify that, give more attention towards the structure, the common topics, the common phrases, like that things you need to give more attention towards. So here I will show you from June 10 to June 13 how you need to utilize your time, because the last minute, it's not about the time for the heavy practice and all, it's for the light revision only you need to do. You can just do some mock test. There are so many websites, we are giving the free mock test facility and all. So you will get some guidelines, or you will get some corrections from the expert. You can do that. So you need to practice the complete test prior to the exam. It's not about doing for some other activity or taking some break in between the listening and the reading section. So whenever you are practicing the listening section or reading section, try to do that completely. Okay, then only you can do like that in the real exam, or else you will be bored in between. Many of them are like that only, because they are hurry-burry with so many household chores or other activities. So they are not taking the complete mock test. The first time they are doing that in the test hall. So it's very difficult for them to stay for that complete hours. Okay, so try to practice with some mock test from June 10 to 13. Rather than just moving with so many things, you can just take some mock test, get some corrections from the expert team. There are so many websites, they are doing some free mock test and all. So you can just utilize that facilities. So all the very best for your test day, and I will come out with the review video or the question paper discussion. We will discuss about all the available question paper. It's not about any particular country we are concentrating on. The preparation guide we are publishing for the global students, and the review or the discussion also we are doing for all the available question papers. So you can also share your experience soon after your test. So we will just discuss during the section. So that's it. God bless you all, and all the very best for your test day. Do subscribe and watch on this page for more OET related updates. Thank you.